So good evening, guys. If I'm visible and audible, just give me a thumbs up. Dr. Sandeep ji, good evening. Okay. If I'm visible and audible, guys, so just give a thumbs up or just let me know. So I'll start the session today. Yeah. Okay. Hi, Dr. Mohammed Ibrahim. Good. Chalo. So let me just introduce myself in about a minute or two, and then we'll start with the session today, which is MCQ revision from anesthesia. Okay. Dr. Sahir and Dr. Deepak. Good to see all of you. Fine. So let me just begin the session, guys, with introducing myself. My name is Dr. Vinish Srivastava. Presently, I am the head of the department and senior consultant in anesthesia and critical care at Fortis Lafam Hospital in New Delhi. Okay. Before this, I worked here at Fortis Lafam Hospital only for the last 8 years as a senior consultant. Before that, I was at Maulana Azad Medical College. I've done my senior residency from there, and I was also a specialist over there. Before that, I was at Deen Dayal Upadhyay Government Hospital, New Delhi. I've done my DNB secondary anesthesia from there. Before that, I was at Mumbai Grand Medical College, Sir JJ Group of Hospitals. I've done my DA and FCPS anesthesia from Grand Medical College, Mumbai. Before that, I was at Lokmanya Tilak Municipal Medical College, Sion Hospital, Mumbai. I've done my respiratory medicine from there. Before that, I've done my hospital administration. And before that, MBBS. With a slight introduction about myself, let me go forward. Okay, so that's me giving, spinal duties during the COVID times. With taking all due precautions, all of you should also take that and be careful. Okay, apart from that, I also have the hobby. I play the guitar. Here I'm trying to play with a local folk band. Alright, and I've also been teaching students preparing for postgraduate medical entrance exams and FMGE exams for the last 10 years. Okay, so being on the Unacademy platform, there are a few things that we get. Thank you for all the following, dedications, and whatever it is. Thank you so much, guys. This is a small YouTube session that we are taking today. This YouTube session will be before the NEET PG revision in anesthesia. Okay, where I'll be taking MCQs and I'll be discussing some concepts behind it. Okay, and as I say, as this was I don't know whether you people are on the Unacademy app or not. If you're on the Unacademy app, so when we had a discussion with the students, the INI CET was taken place recently. Okay, and the results are also out. So do you see, when we discuss the concepts, students are already aware that the same kind of questions come in the exam based on the same concepts. That is what we pay attention to, guys, trying to take care of the concepts. Okay, so everyone is trying to teach in the same fashion that it helps you to understand the concepts based on which you can solve the MCQs and understand that subject also. Okay, so as I said, point is to make everything clear, teach it in a simplified manner. Okay, guys, as all of you have given a dedications. Before going forward, let me tell you that even on the Unacademy app, there are lots of free classes that we have. Okay, absolutely, you just have to download it. There are absolutely free classes, the special class. Okay, and all you need to do is to put a code. You can use my code, Dr. Vinish, all right, for unlocking even the free classes. For any free class, you just have to put a code. Any code can be put in. If you have other codes, you can use it, but you just have to use a code before you unlock the free classes, which are special classes that we have on the Unacademy app. Presently, this is the YouTube session, which is completely free. All right, as usual. So let's go forward. All right, before I just go forward, this was all the ways that in the various months that people have given the feedback and telling the same thing, that we are trying to clear the concepts. As I said, this is what we are trying to do. All right, so point is, if your concepts are clear, all the MCQs get solved. Each and every month, whatever classes we are taking, it's always about the concepts, whether it's YouTube, whether it's special class or the plus course. Okay, it's always based on concepts, guys. Okay, so remember, when you want to unlock even the special course on the Unacademy platform, always use a code. You have to use a code even for the free plans. All right, so please use the code and go ahead with that. Let me start the session. I want it to be interactive. Okay, so please mark your answers also. I'll be seeing it on the live chat. So good evening, Dr. Hijaz Ahmed. As I said, I'm just starting the session. Please take part. which one of the following drugs is essentially stopped before anesthesia? I'm giving you 4 options. Okay, and please mark your answers A, B and C, D. I can see it on the YouTube, on the app right now. Okay, in the live chat. So I'll just wait for 30 seconds and then I'll discuss the answer based on that. Okay, so all of you, whosoever is there, try to solve the question, give me the answer. Yes guys, so Dr. Hijaz, Dr. Sahir, Dr. Sandeep, Dr. Krish Tarun gives an answer, correct? Anyone else, other people? Dr. Krish Tarun has given that answer. Anyone else? So let me go ahead and just discuss it out. Okay, that's an important question. This is based on the pre-anesthetic checkup, guys, PAC. Alright, when a patient has been taken up for anesthesia. Dr. Lokendra and Dr. Hijaz have also given the answer. Correct, all of you are correct again. So I've got 3-4 answers from you guys, and that is the correct answer here, clopidogrel, absolutely correct. Okay, so Dr. Lokendra, Dr. Hijaz and Dr. Krish, absolutely correct. Clopidogrel. So the point is, a confusion instead if you had to be between these two options, clopidogrel and aspirin. But remember guys, aspirin, okay, what about beta blockers? Beta blockers is something that maintains the blood pressure of the patient, hence they are not stopped. They maintain the normally physiology of the patient. You don't stop them. Okay, out. Yes, initially it was said aspirin also needs to be stopped and clopidogrel also needs to be stopped. Okay, they need to be stopped. Point is, with recent times and the recent guidelines, they have said that aspirin does not need to be stopped. Oh, okay. Point is, because nowadays aspirin is being used in a low dose. So you have 2 types of aspirin, a low dose and a high dose of aspirin. A low dose of aspirin, they say, is not supposed to be stopped. Okay, only it's a high dose. You stop it 1 day prior. That too guys in 2 types, neurosurgery or ophthalmic vitreoretinal surgery. Otherwise you don't need to stop them. That's an important thing. It's a change, it's a newer guideline, so don't get confused between this part. Normally we don't stop aspirin, or we are not supposed to stop. Apart from that, a question needs to be asked. The reason that we stop aspirin and clopidogrel is because these drugs, if you don't stop, they are blood thinners, so they increase the chances of bleeding during the surgery. Okay, that's why you need to stop them. Any drug that increases the chances of bleeding needs to be stopped. So that is why clopidogrel needs to be stopped 7 days prior to surgery. Some books have even come down to 4 days now, but most of the books have said 7 days. So still normally we say, so Dr. Harpreet also has given the answer correct. Okay, so 7 days is actually the time that you need to stop. Apart from that guys, remember there are other drugs that need to be stopped. Warfarin, 4 days, correct. Heparin also needs to be stopped. Heparin is of 2 types, unfractionated heparin, alright, and low molecular weight heparin. So unfractionated, books mention 6 to 36 hours prior. Okay, there's a range given. So normally patients are normally not on unfractionated, they are on low molecular weight. This needs to be stopped 12 hours prior. Okay, so any drug that needs to be stopped which cause increase in bleeding. Okay, so here clopidogrel. Thumbs up everyone, you got that point. So I'll go to the next one. Okay, any questions or doubts you can ask me, I'll try to clear it out as well. So this is based on the PAC as to what medicines need to be continued and what medicine needs to be stopped. Okay, important question, kind of. Dr. Panita also gives a thumbs up. Okay, so remember clopidogrel needs to be stopped. Okay, so let me go forward. Now a critically ill patient is been taken up for MRI and will need oxygen during the MRI. Okay, so this cylinder is made up of steel, copper, molybdenum, none of the above. Okay, so please mark your answers guys, A, B, C and D. I'll wait for a while. So Dr. Lokendra, Dr. Sahir and Dr. Panita, Dr. Harpreet have all given yes and thumbs up. Dr. Hijaz, 4 options. What's the answer here? A, B, C and D. Few people are giving me answers. Dr. Krish, Dr. Mohammad Ibrahim. So let me wait for some more time. Dr. Hijaz gives an answer. Dr. Lokendra, Dr. Sahir, Dr. Nirisha, Dr. Panita. Okay, so I think most of you have given an answer which is C, and guys, that is not correct. Dr. Harpreet also says C. No, this is wrong. Most of you have marked C, and that's exactly why I set up this question. It's a common question, yaar. Only one person, Dr. Ashutosh also says C. Dr. Hijaz wrote lithium. It was not lithium, but it was aluminium. Dr. Hijaz, you are right. Dr. Hijaz. Okay, if you are there, you are right. Dr. Sai Prashant and Dr. Ashutosh also have said C. No, yaar. C. That is exactly why we set up this question. And a question comes like this in the exam to confuse you. Remember, कोई भी subject में portion इतना होता है. But what they ask you is only little bit. उसी को घुमा घुमा के पूछते हैं. They ask you the same questions. Okay, the correct answer is not steel, not copper, and not molybdenum steel. See, remember, they have said MRI. MRI means magnetic field. Okay, so therefore, if a patient is being taken up for MRI, it is going to generate a magnetic field here. Alright, remember, everything can get attracted in a magnetic field. It produces that magnetic field over there. सब कुछ attract होता है. If you people have been to MRI, you know that you take off your watch, you take off your wallet, you take off your belt. Okay, you're not supposed to carry it inside the MRI room. We all do that. We've always done it. Okay, the reason is it can get pulled. Alright, and that is the point. You will not be using a normal cylinder. If you use this normal cylinder to go inside, it will get attracted towards it. खींच जाएगा अंदर, locked in the magnetic field. And that's exactly why you don't use the normal cylinders in a MRI suite. They are not used. Alright, MCQ question first now. Normal cylinder is made up of molybdenum steel. This is what all of you had said. Okay, normal cylinder. But guys, for MRI, you need a special cylinder. Okay, and this cylinder, guys, is made up of aluminium. MCQ question. Dr. Hijaz has given this answer. Initially, he wrote, where did he write? Lithium. It was not lithium, Dr. Hijaz, it was aluminium. Okay, so aluminium cylinder is what is being used. Okay, in fact, nowadays people even have started using titanium. Okay, so whether you get aluminium or titanium, both would have been correct options for a MRI suite. Reason is because of the magnetic field. This is a normal cylinder made up of molybdenum steel that you don't use anymore. So if you go back, all right, so in case the same question came with an answer, let me just twist it again. So steel, copper, molybdenum steel and aluminium. In that case, guys, the correct answer would have been aluminium. Okay, now this was just to confuse you out. Everyone knows that cylinders are made up of molybdenum steel, and that's exactly why this question comes in the exam in a twisted form. That's exactly how questions are asked. Even if you go through the INI CET paper right now or all the previous years, everything remains the same. So yes, Dr. Panita, the correct answer is none of the above. Had there been aluminium, it would have been D. Had there been titanium, it would have been D. That's how questions are set in the exam from each and every branch. Okay guys, hopefully you understood that. Thumbs up all of you. And that's how I always do. It's an interactive thing. एक बार interaction होता है तो समझ में तो आता है. We understand if there's an interaction. Yes? That's exactly why we take online classes. No? So YouTube also is also good. It's only just that when you're on Unacademy app, now we take it as a poll. All of you who are there on Unacademy app, even the free ones, na, special classes. In fact, I have my special class today also here at 10 o'clock. Between 10 to, no, 10:30, sorry. 10:30 to 11, I'm having a special class, which is a free class on Unacademy app. Huh? So you can come there, and today I'm taking the second part of Basics of Anesthesia 2. Okay, I finished one on the 1st of December on the special class only. It's a free class actually. Yeah? So today I'm taking Basics of Anesthesia 2. Okay, so if you want, you can be there. Now that's at 10:30. Alright, so now everyone has asked me to go forward. So let me go forward and take up the next thing. Okay. So guys, remember, when you talk of anesthesia machine, let me tell you, I've taken in my YouTube sessions before also, anesthesia machine and cylinders. You know, normally इसमें से एक ना एक question हमेशा आता ही है. There's always a question coming up from this part. So don't neglect it, especially that cylinder part. You know, something from the cylinder always comes, whether it is the color or it is the pin index. Remember this, something from the cylinder always comes in the exam. घुमा फिरा के कुछ ना कुछ cylinder में से आता ही है, because it's used in all the branches here. Okay. So anyways, as I was saying, come on to the Unacademy app today also if you want to. You can unlock it. And as I said, 10:30 to 11, I'm going to take Basics of Anesthesia. Alright. And this is the second part on the basics. 30-minute session, which is totally free, special class. Okay guys. Hope you're also aware of the iconic subscription. This is Unacademy with Prep Ladder mixed together. All of us feel that it's the best thing. Huh? Even I like it. Live classes and batch courses from the Unacademy. Live tests and quizzes. At the same time, you get video lectures and question bank, repeat revision from the Prep Ladder here. ठीक है. So whether you want to choose iconic or you go in for plus, that's how you proceed. Okay guys, also the way that I'm taking this YouTube session right now, on the Unacademy app we have a daily set of 20 questions, 20 questions at 8 p.m. all of us contribute to it. So this was for NEET PG 2021, and at 9 p.m. guys we have another set of questions that is for NEET PG 2022. These are totally free yaar, so please attend and give the MCQs. It's for your own good, even I feel it. Solve as many MCQs as it is possible. Where you go wrong, please read it. What's the reason behind it? That's how you go about it. Okay, so download the Unacademy app, and you need to log in using a code. You can use this code or any code that you have with you, and then you can log into the free sessions also. Okay, next. So please answer. Drug of choice for electroconvulsive therapy. There are 4 options given to you. So please mark your answers or just let me know. I'm sorry, I have got a habit of mark your answers because that's how we take it on the Unacademy platform. I'm trying to do the same thing here, sorry. So please mark A, B, C, D. So Dr. Krish, Dr. Chandan gives their answer. Dr. Sahir, Dr. Krish, Dr. Ibrahim, Dr. Harpreet, Dr. Lokendra, Dr. Panita, Dr. Lokendra, Dr. Sai Prashant, Dr. Ashutosh. So, confusion between 2 things, as I can see. Dr. Lohit is also there, Dr. Surbi, Dr. Nirisha, Dr. Hijaz. Okay, confusing. Now people have given answers between 3 of them. So, drug of choice for electroconvulsive therapy. But most of you are actually right. With Mohammad Ibrahim, Dr. Nirisha, Dr. Krish Tarun, Dr. Surbi, and Dr. Chandan. Till now the answers that I have got, they have all marked the answer as B, methoxytol. Okay, which is the correct answer, guys? Drug of choice for electroconvulsive therapy is methoxytol. Dr. S. Mani Miglai, you have also given B. Dr. Sahir also gives B. Correct. So that's the correct answer, methoxytol. So most of you, I'll feel almost 80% of you have given me the correct answer, which is good. Okay. Ketamine is not a drug of choice, guys. Neither etomidate. Okay. Drug of choice means what is the preferred drug when you want to give electroconvulsive therapy. The correct answer is methoxytol. Normally, we have not heard about methoxytol, but still, it's a drug of choice when you want to give ECT. By the way, when I was doing MBBS, I was not aware that you have to give anesthesia before giving ECT. I had no idea. I used to just think like how they show in movies, na? Hero ko aisa pakada hai, or doctor is coming like a villain and putting this. I used to feel the same thing when I was in MBBS time. Okay, I used to feel we don't need anesthesia. But guys, it's not like that. You do not give ECT without giving anesthesia, and the drug of choice is methoxytol. Reason? So let me tell you the reason for that. The reason is that methoxytol is a barbiturate. Barbiturate, guys, you already know it. When you read KD Tripathi, barbiturate group is a group of drugs which is that sedative and hypnotic. Barbiturates are classified into 3 types: long acting, intermediate, and short acting. Long acting, you already know phenobarbital, which is used in epilepsy. You people are already aware of that, phenobarbital. Okay, you already know it. Short acting, guys, barbiturate, there are 2 drugs, thiopentone and methoxytol. These 2 are used for anesthesia. Okay, these 2 are used for anesthesia. Thiopentone everyone knows. Okay, most of you will be aware. Methoxytol, guys, is a drug which is, if you see phenobarbital, it is used for epilepsy, na? Anticonvulsant drug. Thiopentone, very good anticonvulsant. So normally barbiturates have a property of being anticonvulsant. Okay, prevent the seizure. But methoxytol is a proconvulsant drug, means it ideally causes seizures. How is it helpful? Because what is ECT? ECT is electroconvulsive therapy. You actually want convulsion to take place in the patient. Therefore, if you use methoxytol, it is helping the seizures to take place. It is helping the ECT. Alright? But the point is, why haven't we heard about it so much? And the reason is side effect. There are 2 side effects. The important one, it causes HPA axis suppression. Okay? Because of this HPA axis suppression, pura steroids gaya, no catecholamines, and that is the reason why this drug is not used anymore. Also, it has high incidence of nausea, vomiting, not used anymore. So therefore, if a question comes in exam, what is used nowadays for ECT? So nowadays, guys, what people prefer is use thiopentone or propofol, okay, and follow it by succinylcholine. It's a short-acting muscle relaxant, and then you give the shock to the patient ECT. Okay. However, a lot of you might say, sir, but thiopentone is anticonvulsant. Correct. You are right. It is not helping the process of ECT, but thiopentone and propofol become safe for the patient. Therefore, in anesthesia, the important point is safe hona chahiye pehle. Okay. Methoxytol is not safe that much anymore compared to thiopentone or propofol. Though methoxytol is the drug of choice, it is not used anymore. Everyone understood that point? Thumbs up. Okay, thumbs up or whatever. इसमें तो मेरे को लगता नहीं कि clap या slap है ना. You get claps and slaps also, right? So normally when you are in a platform, you get the slaps, you get the claps, both the things. Okay. So any questions and doubts, guys? या कुछ समझ में आ गया तो पूछो, नहीं समझ में आ गया तो भी पूछो. Dr. Sahir gives a thumbs up. Okay. Okay. So let me go forward here. I mean, I hope there are no doubts. If there's anything, you can ask me right now. Okay. So administration of thiopentone can cause. Dr. Mahesh, good evening. Good evening, yaar. So take अभी मेरे को question का answer दो, उसके बाद we'll also discuss. Okay. So we'll discuss this also. Dr. Mahesh. Okay. Dr. Mohammad Ibrahim also gives a thumbs up. So administration of thiopentone causes 1, 2, 3, 4 A B C D. Mark your answers. Mark नहीं मतलब type your answers here so that I can see it on the YouTube. Mark your answers when you are on the platform. The poll that we take. So Dr. Nirisha, Dr. Lohit have given an answer. Dr. Mahesh, Dr. Krish, Dr. Sahir. Easy question था क्या? The one which I thought easy turned out to be difficult. The one which I thought difficult turns out to be easy. But it's good. That means you guys have studied well. Okay? So all of you, Dr. Mohammad Ibrahim, Dr. Krish Tarun, Dr. Mahesh Saini, Dr. Sahir, Dr. Lohit, Dr. Nirisha, all of you are absolutely correct. Okay? So administration of thiopentone can cause what? Increase in heart rate? Yes. Histamine release? Yes. Laryngospasm? Yes. Hence, all the symptoms. So correct. Dr. Lohit Kumar says related to other symptoms. Actually, histamine release is a property of thiopentone, Dr. Lohit. Okay, that's why thiopentone becomes an important drug. See, normally when you give anesthesia drugs, okay, so they are all depressant drugs, okay. They will depress everything in the body. So therefore, let's talk about CVS. So what happens to the CVS? Thiopentone you've given, it decreases the blood pressure. What is the body response to blood pressure? To increase the heart rate, okay. Reflex tachycardia. So therefore, you get an increase in heart rate, which normally is not seen with propofol, okay. Propofol does not increase the heart rate. On the other hand, profound hypotension is seen with propofol. Okay, that's again an MCQ question. So CVS, you find increase in heart rate. You talk about respiratory system. So when you talk of RS regarding thiopentone, so thiopentone normally is a respiratory depressant again. So it will kind of produce apnea. Patient stops breathing. Okay, so patient stops breathing. Apart from that, what it does is it also causes histamine release. Okay, and because of this histamine release, I mean, this is how we learn it when you put it in the RS. So there are two things normally that will happen, and these are properties of thiopentone. One is it can cause laryngospasm, bronchospasm, and second thing, it also causes pruritus. Important question, because thiopentone can cause pruritus and propofol on the other hand becomes antipruritic. MCQ question, मतलब खुजली का दुश्मन, दाद खाद खुजली का दुश्मन. Okay, that doesn't mean if someone is having khujli at home, you start giving propofol. No? Please don't do that. All right, don't do that. So propofol, guys, remember, is antipruritic agent, not to be used routinely for pruritus. Okay, someone says, oh, आज मेरे को itching हो रहा है, ले propofol ले. You can't do that. Okay, you can't do that. Anesthesia drugs, dangerous ones. All right. So thiopentone, guys, on the other hand, can cause pruritus. All right. So this is thiopentone. Dr. Hijaz says, but used in asthma patients? Question mark. I will not use it because Dr. Hijaz, the drug of choice for asthma patient would be ketamine. If not ketamine, you will use propofol for better properties. Therefore, none of the books in anesthesia mentioned don't use it. Anesthesia is such a branch, na? When you read textbook, they say you use everything. You use anything you want. For example, let me give you एक और question शायद मैंने set किया है. Wait, I'll discuss that question out also, and then I'll tell you what I mean by this. Okay, about asthma patient, let me discuss it out. So as I was saying guys, special class bhi agar chahiye hoga, free plan, use the code. Please remember that if you're coming to my class today, so 10:30 to 11, okay, at basics of anesthesia part 2, that's what I'm taking, half an hour. All right, and this is about my complete course. This I'm starting on the 7th, 9th and 11th, 21 and 23rd December, और उसके आगे in January also. Plus we have intensive revision batch on the Unacademy platform, which you know keeps on going on and on, चलता ही रहता है. Okay, all this is going on. This is on 14th, 15th and 16th. Complete revision for 2021. I'm going to take that. All right, remember the okay. एक और चीज़ मैंने नहीं बताया. That's my Telegram ID, Dr. Vinish. Any questions or doubts, just search in Telegram as Dr. Vinish. I'm the only one in the whole world, Dr. Vinish. Okay, on the whole world. Supposedly, till now, as Dr. Vinish. कोई और भी हो सकता है, but as of now with this ID only I am there. Nothing. Dr. Vinish, search me on Telegram. You can ask me any questions, any doubts. Okay, and plus we have all the Telegram links from the Unacademy platform and the Instagram links that are already provided to you. Okay, you can also subscribe at the Unacademy platform also and YouTube also, guys. Okay, so next question, and then we'll take it as the last question for today. So atracurium is known to cause, so please mark your answers and we'll have a discussion on this. और ये आंसर, किसी का आंसर नहीं आया. डॉक्टर सुरभि gives an answer. Dr. Mahesh says that's a good one, I liked it, Dr. Mahesh. So Dr. Sahir, Dr. Surbhi and Dr. Krish have given an answer. Dr. Geeta Singh gives an answer. Dr. Mohammad Ibrahim gives an answer. So anyways, बाकी किसी का बाकी है या मैं डिस्कस कर लूँ इसको? Let me discuss it out. Okay. अरे हर बार all the above नहीं होता है. All the above is not the answer. Only histamine release. Okay. Atracurium is not known to cause thyroid dysfunction, not hypertension. हर जगह all of the above नहीं होता. So correct answer, most of you, Dr. Amit Kumar, Dr. Mohammad Ibrahim, Dr. Geeta Singh, Dr. Sahir, Dr. Surbhi have all marked it as C. Okay. So remember guys, atracurium is known to cause histamine release. Okay. And as I was saying before also, histamine release, when I was discussing thiopentone, I said thiopentone also causes histamine release, and Dr. About asthma, who had asked me, Dr. Hijaz has said used in asthma patients. Dr. Hijaz, atracurium ideally causes histamine release, contraindicated in COPD and bronchial asthma. Okay, so book says don't give it, but guys, we give it. Nothing happens to the patient. All right, that's the whole point of discussing it. So therefore, many times you find things given in the books, ideally not to be done, because that happens in 90% of the cases. But many of the times when you think that someone is having a renal abnormality, liver abnormality, and you want to use atracurium, so still we use it. And that is the problem why people made a new drug called cis-atracurium. The reason for making cis-atracurium was the same thing, because ideally atracurium should be avoided in asthmatic patients because of that histamine release and bronchial asthma, not to be used. Okay, it can cause bronchospasm. Cis-atracurium on the other hand, it does not release histamine. It is more potent than atracurium. Okay, it retains the same Hoffman's elimination. And that is why cis-atracurium turns out to be a better drug than atracurium. And that's why they developed it. Okay. Thyroid dysfunction. What causes thyroid dysfunction? What should not be used, I'll rather say. Thiopentone. Thiopentone is a drug not to be used in thyroid patients. Yes, Dr. Sahir, even laudanozine. Correct. It causes decreased levels of laudanozine. Absolutely correct, Dr. Sahir. So these are the 4 points which come from cis-atracurium. The reason why cis-atracurium was made. Okay. Histamine release nahi hai. It's better than atracurium in terms of potency. It retains the Hoffman's elimination, less levels of laudanozine. Okay. Dr. Mahesh says hypotension karta hai. Yes, it can cause. Instead of hypertension, atracurium can at times cause decrease in blood pressure, but it's not very important for you. It won't be asked in exam. You don't need to know that. It can cause at times. Okay. However, these are not the drugs which actually cause change in CVS. And that is why this question is not asked to you. Don't worry. The questions, they normally what they ask you from the muscle relaxants guys is the drugs that cause change in the CVS. So you know which drugs are those. Pancuronium, increase in heart rate and BP. Rocuronium, increase in heart rate. Galamine, increase in heart rate and BP. Guys, these are the normal 3 questions that come. Extra पढ़ने की ज़रूरत नहीं है. Don't read extra. Read only what is needed. You don't have to become anesthesia people. Only what is needed. Okay? Extra knowledge नहीं चाहिए अपने को. Okay guys, so this was about atracurium, neuromuscular blocker. I hope I've tried to clear some of your doubts in the questions that I discussed. Alright, and I'll have another YouTube session that would be on 17th I think. उसमें भी I'll try to discuss MCQs only. No, December, sorry, not Jan. And anyways, I'm having my special classes at the app, so you can take those which are completely free. Okay, today also 10:30 to 11 I'm going to take basics of anesthesia. I'm not discussing what questions are there and what topic it is there, because I want you to answer the question. Okay, so you can download the app and you can unlock it using the code Dr. Vinish. Okay, because you have to use a code nowadays, guys. Okay, any questions and doubts? Thank you for joining me, all of you. Dr. Sahir, Dr. Mahesh, Dr. Hijaz, Dr. Lohit, Dr. Nirisha. Okay, Dr. Mahesh, Dr. Amit Kumar, Dr. Mohammad Ibrahim, Dr. Geeta Singh, Dr. Krish, all of you, Dr. Surbhi, Dr. New Holal, different name, but it's okay. All right, all of you, there's so many of you. Thank you for joining on this special session here, YouTube pe. Doctor, all of you, Dr. Nirisha, everyone. Thank you guys. Okay, so people, I'll catch you up on the special app. Okay, Unacademy app now, 10:30. उधर भी question का answer करो. Then we'll have a small discussion there as well. Okay, Dr. Ashutosh AJ. So thumbs up. Okay, good night. All the best, guys. Don't worry. Last point before I just leave it. In case you're not joining anything now, please go through our YouTube sessions, which are completely free. Go through our special classes, which are completely free. The subject that you find is weak, we have covered most of them like this only here. We have had discussions on MCQs and we have discussed points related to that. Okay, so this will be helpful. Yeah, just go through them wherever you feel you're a little bit lacking in your efforts. Okay, it's not necessary that you have to do everything. All right, chalo, good night, take care. Okay, it's a lovely session. Thank you for joining me. Thank you. I like something like this. Interactive में मजा आता है. Thank you. Okay.